As the Jackson director, Zoe Lyons.
Good morning.
Congratulations.
It's really hard to do this with you two dresses.
I was going to say, well, we had Dr. Dan Phelan on first,
Yes.
and, you know,
They were good
that
sports.
was difficult
Yeah.
as well, but they enjoyed it, so.
They talked very serious topics, looking straight dead
Yeah.
into my
Right.
poopy eyes.
Right, there you go.
Well, congratulations to you
Yeah.
and your husband.
Yes.
Yeah, what a career.
We retired on the same day from the state of Michigan.
That's awesome.
Wow.
How long
Yeah.
did you guys have that planned? To retire on the same day?
Not very long,
Okay.
because he was going to retire about 6 weeks before me, but he ended up having a surgery, and it took him off past his original retirement date.
Oh,
So then
gotcha.
we said, let's just do it the same day.
Did you meet at the state of Michigan? Like working
No,
at the
we
state of Michigan?
met at Michigan State University.
Oh,
Okay.
nice. Okay.
So when
we
you-
lived
what
on
was-
the same floor in the dorm.
Really?
Yeah.
What? So what was your first job for the state?
Well, I like to say my first job was for the state was as a daughter of a state employee.
There you
So
go.
I'm a second generation person. My
Okay.
father retired from the Department of Social Services back then. But my first job was as I had a caseload of Medicaid and food assistance and cash assistance, and I worked in Ingham County.
Yeah.
That
Oh,
was
no
my
kidding.
very first job.
What's it been like having a career helping people that really are struggling most of the time?
You know what? It's amazing. I really wouldn't change a thing. The only thing that I have always said is, because I did Children's Protective Services at a really young age, before I even had children, I started doing that work, and I just have a little bit of a skewed. I cannot look at the world with rose-colored glasses like
Sure.
some folks.
I understand, yeah.
So that's the only thing that I would say, man, I wish I didn't have that.
Yeah.
But also maybe it's helped with safety. Who knows over the years.
Oh, you
So-
just have to think about the kids that
Yeah.
you do help, right?
Yeah, right. You just have to really stay focused on the positive. The kids that you've been able to get back with their families and the resources that you've been able to provide. But it's really been an amazing 34 years.
Amazing.
Well, I think your impact has been felt, throughout the county, and it's a loss. Even though it's
Yeah.
well deserved, it's a loss to learn of your retirement. But you're not done serving the community.
No, I'm not. I was officially retired for 5 days, which I say I really nested in my house. I cleaned out closet. I
Sure.
was so tired. And then I started a new job last week
Perfect.
with the Nonprofit Network.
Okay.
So I'm a consultant, capacity building consultant,
Nice.
and it's a very small company, and I'm just learning the ropes.
Great.
So
Yeah,
I
awesome.
hope to. I'm going to continue doing ACE trainings, Adverse Childhood Experiences, for the community with
Okay.
Dr. Bob Powell from Family Service.
That's right.
Oh,
Legendary
nice.
Dr.
Yep,
Bob Powell.
legendary Dr. Bob.
Yep.
And then maybe we'll be able to do some additional trainings for the folks who work with Nonprofit
That's great.
Network. So.
Yeah.
So you went right back into work. Hopefully you're going to schedule some downtime. What are you looking forward most with a more flexible schedule?
Well, my middle son is engaged,
Ooh,
so we have
congrats.
a wedding to plan, and we have a potential vacation to Germany or Europe
Nice.
next fall.
Very nice.
So yeah, my husband's a big World War buff, and
Yeah.
Sure.
so he wants to go to France, and
Oh, very
we're
nice.
gonna just go all
Do
over.
all
And then
the
I want to
things.
do Italy and Greece.
Very
so,
good.
Yeah, we'll just.
Let me ask you,
do it.
because you had a 34-year career in Health and Human Services. What's been the biggest, the biggest difference in the way families are struggling? Is it more today than it was back then? Is it more complicated today than it was when you first started?
Boy, that's a tough one. Because our department is really focused on folks who are living in poverty.
Right.
I think that over the last, probably really my time in Jackson, the last 7 or 8 years, so adverse childhood experiences, that just knowledge about that really has flipped how I have looked at the world. And so I've trained all my staff and everyone who will listen about how childhood adversity can really lead people into adult difficulties and then needing the services that we provide. I also think the systemic racism, which it creates a path to poverty for folks of color,
Sure.
and those two things together. I don't think that they're new, but I think they're coming to light in a way that they haven't, 30, 40 years ago.
Sure. Interesting.
And so we've really been focused on interrupting those things,
Yeah.
Yeah.
preventing them.
Yeah. Well, thank you so much for all you've done. I mean, it's amazing. Bart and I were talking, and Jen, how many times we've had you on the show talking about the great initiatives you guys have going, and foster care, and just so many things that
and
are
we
needed.
really appreciate that. We don't know who the new director is yet, so I can't announce that, but I'd love to get whoever that is connected with you, because it's just been great to connect with the community through JTV. So thank you.
It's been awesome having you. We always enjoy when we see Zoe Lyons' name on the call sheet.
Yes.
So
Thank you.
Very, very good.
Thank you so much.
We appreciate it. Do you have a Halloween costume in mind?
I don't. I haven't dressed for Halloween in years.
Really?
No?
Yes.
Yeah.
But now you're making me think about it.
Well,
so
this
I'm
is
gonna
a
have
very,
to.
very easy costumes today.
Yeah.
So
Yeah.
awesome.
Cute.
Well, thank you so much for being with us, and congratulations on a wonderful career, and look forward to working with you in your next career.
Thank you. Thank you.
Retired, now retired Zoe Lyons from the Michigan Department of Health and Human Services. More of the show after this quick break. Stay with us.